kidney biopsy procedure. What should you do prior to kidney biopsy procedure if you're taking platinum medication such as warfarin, Eliquis, Xarelto, Pradaxa? If you're taking warfarin, you should recheck your INR about 2 weeks prior to procedure. If your INR history is not stable and your current INR is critical, then you need to make sure your INR back to normal at therapeutic level. So they might need to hold your warfarin and reduce the dose and have you come back in 1 week to make sure that your INR return to the normal range, to the therapeutic range, before they can plan for the procedure. When your INR has the therapeutic range, they will have you to hold for 4 to 5 days prior to the procedure. If you have medical condition indicated you must be breached with the Lovenox injection, then your doctor who manage your warfarin or anticoagulant, they will instruct you how to start your Lovenox injection, when to stop, when to start your Lovenox, when to stop Lovenox before the procedure, and when to resume. That's very important. You need to follow your doctor who manage your warfarin or the anticoagulant. If you are taking the Eliquis, Xarelto, or Pradaxa, you may need to check your kidney function. Make sure you have up-to-date labs that require. If your lab more than 3 months old, then you may need to eat the labs. It depends on your kidney function. You may need to hold more than 2 days. If you have normal kidney function, you only need over 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold Eliquis, Xarelto, or Pradaxa more than 2 days. When you have bad kidney function, then you may need to delay to resume your Eliquis, Xarelto, or Pradaxa. Your doctor who manage your platinum medication or your anticoagulant will give you complete instruction when to stop and to resume Eliquis, Xarelto, or Pradaxa based on your kidney labs. But you may need to ask or check with your surgeon or proceduralist when is the best time to resume. If they delay to resume your platinum medication, you need to discuss that with your doctor, manage your platinum medication or your anticoagulant. If you have any further question regarding your kidney biopsy procedure, let me know. kidney removal procedure. What should you do prior to kidney removal procedure? If you are taking a platinum such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your iron about 2 weeks prior to the procedure. If you are stable with warfarin for a few months, then and you have a therapeutic result, you might need to hold 4 to 5 days prior to the procedure. If your iron result a little bit high, then a little bit elevated, you may need to adjust your warfarin dose a little bit, then hold 4 to 5 days. If you have really high or very elevated INR or critical INR, then probably you need to fix your INR to make it therapeutic before you can plan for procedure. You may need to come back in 1 week to see if your INR improve, so you can plan for the procedure. And if your INR improve, then you might need to hold 4 to 5 days prior to the procedure. When you hold your warfarin more than 3 days, you should plan for reaching with a low-venous injection if you have a history of recurrent blood clot, recurrent stroke, and strong risk factors of having blood clot or stroke. When you have to bridge with the low-venous injection, it should give you a separate instruction when you need to start your low-venous, when you stop before the procedure, when you should resume your low-venous after the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs. If you have your current labs more than 3 months old, in the labs within normal limit, then you may need to hold for 2 days prior to the procedure. If your kidney labs not within normal limit, if you have kidney disease and your creatinine clearance less than 50, then you may need to hold more than 2 days. When you need to hold more than 2 days, then you may need to delay to resume your Eliquis, Xarelto, or Badaxa. So, your doctors who manage you, Eliquis, Xarelto, or Badaxa, or the anticoagulant will give you the complete instruction when you need to hold Eliquis, Xarelto, or Badaxa and to resume after the procedure. However, you should check with your surgeon or proceduralist to make sure you are safe to resume your platinum medication. If you need to delay to resume your platinum medication, then you need to discuss that with your doctor who manage your platinum medication. If you have any further question, please let me know in the comment box below. Thank you. Prostate biopsy procedure. What to do prior to prostate biopsy procedure if you are taking a blood thinner medication like warfarin, Eliquis, Xarelto, Adaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result at therapeutic, then you will need to hold for 4 to 5 days prior to the. If your INR history is not stable, your INR result is elevated, then you may need to adjust the dose and come back 1 week if needed to make sure your INR improve before and plan for the procedure. If your INR is critical, then probably you need to hold your warfarin and adjust the dose, reduce the dose, then come back in 1 week. Make sure your INR is improved so you can plan for the procedure. If you have to hold your warfarin for more than 3 days, then you should plan bridge with a lower nerve injection. If you have history of recurrent blood clot or stroke and strong bridge factor for having blood clot or stroke. If you have to bridge with the lower nerve injection, you should follow the instruction from your doctor who managed your warfarin or the anticoagulant to make sure you understand when to start the lower nerve injection, when you need to stop for the procedure, when you should resume your lower nerve injection. If you are taking the Eliquis, Xarelto, or Badax,